Hi there, I'm your host, Julia Fuentes, Financial Planning and Coaching Senior Specialist at Vanguard. If your clients are asking why an HSA is a great option, you're in the right place. Today, we're going to go over the key benefits of HSAs, discuss how they compare to things like FSAs, and walk through a real-life example to tie it all together. So let's jump in. This is comparing flexible spending accounts to health savings accounts and to health reimbursement accounts. And for your clients, it's all one and the same. They're like an FSA, an HSA, it sounds the same. So it's up to you as an advisor to educate them on the differences. And by far, FSAs and HSAs come up the most. So the difference between the two, with flexible spending accounts, there are FSAs for different purposes, like a dependent care FSA, a healthcare FSA. Oftentimes I get the question, can you have both an FSA and an HSA? And the answer is, you can, but if you have an HSA, you can only do a limited purpose FSA for healthcare expenses. So I know, here at Vanguard, we have a limited purpose FSA that you can cover some of your dental. So that's an example of a limited purpose versus a general healthcare FSA. So with FSAs, it's use it or lose it. During open enrollment, you sign up for it. You say, this is how much I'm going to put in, and I'm going to get a tax benefit for the tax year. So this is going to help you tax-wise. With a health savings account, they have higher contribution limits. But with the HSA, you can roll this over if you leave the employer, and we would encourage you not to spend it each year. If you can let it ride, you can use this as an investment account into the future. So really great for portability, and you don't have to use it or lose it, and you still get those tax advantages. You don't see HRAs as much, but some of your clients will have them, but your employer fully owns that, makes all the contributions. So the big thing here to understand is with a health savings account, you have to have a high deductible health plan in order to do an HSA. So if your client doesn't have the high deductible health plan, they may only have the FSA as an option. So the four key benefits of a health savings account. Number one, triple tax advantage. It's the only investment account out there that you're getting that triple tax advantage. You don't have to pay tax going in. You save on FICA taxes. If your employer takes your contributions to the HSA right out of your paycheck, you don't pay that Social Security Medicare tax. In most states, you can save on the state tax, you can save on the federal tax. Then that money grows tax-free. So you're getting all that deferral over all of those years. Then once you're retired or any time in between, you can take money out for any qualified medical expense, and it's entirely tax-free. So what a great investment vehicle that if we can fully maximize it, we all have healthcare costs, especially when we're retired. And our costs start to get a little bit more expensive as we age. People love that these are portable, that you can take them with you if you leave your employer. And you can do these even if, let's say, you retire early and you go on the Affordable Care Act plan. You can choose an HSA qualified plan and you can still put money into that and help reduce your income, because keep in mind, HSA contributions are an above the line deduction, meaning it reduces your AGI, which can qualify you for certain programs, such as premium tax credits for the Affordable Care Act. Then in the future, if you can save, invest this money and let it grow, it'll grow over time and you're not going to be required to take required minimum distributions. Once you turn age 65, This account is even more beautiful because you can pull money out of it. Even if you want to buy that Maserati you've had your eye on, you can pull the money out and pay the taxes just like you would in a traditional IRA. High net worth people love this because you don't have income limitations. You can fully maximize your contributions. I have some families that are high net worth that they have, the husband, the wife, and 2 adult children on their healthcare plan, because we know our children can stay on our healthcare plans until they're age 26. I'm sure my son will be on it until 26. And then the older adult children, they're working. They're just not opting into their health plan through their employer, and they're filing singly. Well, these high net worth clients, what they'll do is they'll fully fund up to the family max for their own HSA, and then also fund for each of their adult children up to the family max. So you can really stockpile a lot of money in separate HSAs to benefit everyone. Now, it's much easier to understand this thinking about a case study. So keep in mind, most clients balk at the high deductible. It's scary. It looks really big. So looking at this is actually a real client scenario that we copied to give you an idea of this family and their decision tree. It was coming up on open enrollment. This is a great time to attract new clients. Think about it. If you understand their benefits and you can help a client understand their HSA and should they do the FSA or the HSA, and you can have a quick conversation about it, you could go through LinkedIn, try to bring in new clients from that organization. Hey, I understand your benefits package. I'd like to help you too. So this is a great way. Some people lean in during open enrollment to attract new clients. Well, looking at this one, the PPO, $500 biweekly. High deductible health plans typically will have a much lower premium relative to just the standard PPO plan. Well, this family, it's a family of 4. They have 2 kids and they use a lot of healthcare. Last year, looking at their healthcare, they had 6 specialist visits. They went to urgent care 12 times because, hey, we have kids. Things happen on the weekends. And they visited the doctor 36 times. So they were using a lot of healthcare. So they did meet their deductible. So with a high deductible health plan, $5,300, that seems like a lot. When we could have only a $1,500 deductible if we went with the PPO. But a lot of the preventative visits, those are all covered with both plans. With going to the doctor, a lot of these PPOs, they have a copay that they say, hey, you have a copay every time you go to a doctor or a specialist. That's an additional cost. And a lot of these plans also set a max out-of-pocket limit per person. So if one person gets in an accident, it's usually capped. But last year, this family didn't have any major accidents. So you can see, if they went with a high deductible health plan, their employer will give them $2,000 towards their health savings account. They could spend that if they want on their medical costs, but they're going to let it ride. They're in a pretty high tax bracket, so they're going to get that $2,000 from their company, and they also are going to defer money into their HSA themselves for a total of $8,000 that they're going to put in there. Well, the tax benefits of that, they're saving the FICA taxes, they're saving their federal income taxes, they're in the 32% bracket, and also they live in the state of Pennsylvania where we have a state tax. That is an annual tax savings of more than $3,400. By letting that money ride for 20 years, not spending their HSA dollars, they have a huge investment account with a lot of investment earnings. They can use that in the future to reimburse themselves for their Part B Medicare premiums, pay their dental and vision costs, and HSAs keep expanding in flexibility for what we can use it for. We can even use it for our long-term care expenses. So it's a great savings vehicle to consider for our future benefit. Thanks for watching today. Like, subscribe, and turn on notifications so you never miss an update from our team about healthcare in retirement.